Good evening, everyone. We're going to get started in just a second. If everybody could go to their seat, that would be great. So we can start our program. I want to thank you all for being here tonight. Our team here at GLFHC has been looking forward to this night for quite a long time. We have a special evening planned tonight with some great speakers, some well-deserved recognition for our Making a Difference award, and some other special recognition after dinner. And all of this while you are helping us raise significant dollars to expand our behavioral health program. And to get us started, we would like to share a short video with you about behavioral health at Greater Lawrence Family Health Center.
Behavioral health care is defined as an umbrella term for care that addresses the impact of behavioral problems on health. It encompasses mental health care and substance abuse treatment, as well as health-related behaviors and the effect of stress on physical symptoms. As you will hear and learn tonight, GLFHC is focused on expansion of these services in order to provide the best possible care for the whole patient, the true integration of behavioral health and primary care. We hope that you'll consider joining us in making a difference and supporting this expansion for our community.
It was April last year. Now my doctor recommended that I do like therapy. Technically, African culture, we don't really welcome therapy. We talk to families or we talk to pastors, but I was recommended to speak with Eric, and for me, Eric is like a godsend. He was able to listen and also able to offer me support that I never thought was available.
One of the things that stands out most is the fact that behavioral health services, mental health services are not easily accessible in communities at large, but especially when there are a number of barriers to really feeling like they're appropriate and effective services. So we also know that most patients who have mental health needs are going to be seeking out that care from their primary care clinician and in their primary care clinics, rather than seeking out those services in specialty mental health clinics and services elsewhere out in the community.
GLFHC being historically planted in Lawrence, Massachusetts, a place that's highly immigrant, carries that tradition for the population that we serve now. While at one point it was Irish, now it's Latinx, but it's a highly immigrant population who come with a lack of a system of structure relative to how to engage healthcare systems, how to engage their everyday lives, how to navigate the consequences and demands and stressors that come with everyday life.
GLFHC has provided behavioral health services for our patients for 8 years. We're now poised to get to the brink of greatness by investing more funds into more clinicians and more facilities and ways to reach our patients as never before. That will include group visits, more sessions in the evening, more space, and an expanded group of clinicians. Those are what are needed most to help our patients the best.
So thinking about the unique impacts and considerations that we need to be thinking about with our patients here, I think incorporating behavioral health services into the primary care environment and letting behavioral health providers be a part of the primary care team really impacts how well we get to know our patients and how we're able to address all of the unique aspects of their experience within a team approach to care that makes sure we're thinking about the whole person. And that includes all the barriers and all of the things that impact their health overall, while also making sure that the team is thinking about all of the resources we have and ways that we can work together to provide care in a way that suits what each individual needs, which then I think inherently contributes to what our community at large needs.
No, COVID has made it obviously challenging for any population, and certainly those who are most vulnerable have been most affected. GLFHC and its community, its patients have been just as affected, if not more so, than the most vulnerable, because they are the most vulnerable. Those who are frontline workers in service industry and grocery stores, even in healthcare centers, are going to need to always be at biggest risk. And so COVID has affected our population highly.
It kind of also gave me like a perspective to look forward to, like when we have the next meeting, to like, I want to give him like good like feedback on what I've experienced, or I'm also willing to share like downtimes that I've experienced after like we had this conversation. And I remember one time he told me that the brain is such as the brain works in a way that what you focus on is what becomes. So he taught me how to like always like push the negative thoughts aside and continue to like focus on positive things, which kind of helped me. And overall, I've seen so much improvement in myself, and I'm able to be a better mom to my kids.
Thank you for joining us tonight for the 17th Annual Making a Difference Gala. We hope you will consider supporting GLFHC and our patients tonight as we look to expand behavioral health services in our community in order to enable our clinicians to always treat the whole patient, body, and mind. Your donation will help GLFHC expand behavioral health services to thousands of more patients, and your support will directly impact this community in ways we can only imagine. Thank you for being part of our mission to serve those most in need in all aspects of healthcare delivery.
That you all enjoyed that short video about behavioral health and what it means to our patients, what it means to our community. And one thing that COVID taught us a lot, it sure did, but it also exposed the need for us to provide not only more behavioral health services to our community, but also the need to be better coordinated at the same time. The funds that we raise this evening will help us do that. It will help us expand behavioral health in this community, and it's so needed, as you just saw and heard from some of our clinicians, our director of behavioral health, and as well as a patient who told you firsthand of what it means to her. And there's more people like her, a lot more people like her at Greater Lawrence Family Health Center. Right now, I'd like to it's my pleasure to introduce our president and CEO, Dr. Guy Fish, who is not so new anymore as he approaches his one-year anniversary. Please welcome Dr. Fish to provide some more welcoming remarks.
Good evening, everybody. Good evening, everybody. There we go. Thank you. That video was amazing. Big shout out to Mark LeMay, who is one of our multi-talented people here at Greater Lawrence Family Health Center. He produced that video in-house. I'll speak more about the film in a moment, but let me start off by saying how delighted I am to be here with you all tonight. The vast majority of you are either native to the Merrimack Valley or longstanding citizens, and I'm just getting to know the community for the last 10 months. I've met many of you, but I hope to meet all of you as the time comes. With that in mind, I want to say that overall, I can't imagine a warmer, more welcoming community than I've experienced. For that, I thank all of you. People often ask, why did you take a job in Lawrence? And my usual response is, why not? Lawrence is a great community with really fantastic people. Greater Lawrence Family Health Center is a legendary organization going on 42 years with many firsts to its credit, including the first residency program in a community health center, not in a major hospital. And there are many great and important social issues that we are called upon to fix. That's what leaders do. We rise to the challenge of fixing social problems. As a physician and a business person, I spent several decades understanding, advising, and investing in cutting-edge healthcare technologies. Sometimes those were drugs, or sometimes they were devices, sometimes diagnostics. And those all play a major role in the lives and health of ourselves and our loved ones. However, as fantastic as some of those discoveries and advances are, they matter very little if we can't get them into the hands of the patients who need them, especially those who are poor, those who are immigrants, or simply have fewer means than we are blessed with. That means that their quality of life erodes. That means that sometimes their lives are cut short. So access to care and care delivery is perhaps the most critical link in all of healthcare. In the telecom industry, people talk about, the last mile of service delivery being the hardest. It's access in healthcare, getting those drugs, devices, diagnostics, and behavioral health therapy to the individuals. We know a lot about the diseases, the biology, but if we can't give access to people who need it, then what good is that? So it excites me every day to get up and work with teams of talented GLFHC leadership and staff to solve problems, making the lives of residents here markedly better. One of the exciting things about Merrimack Valley is that it's just the right size to be able to innovate and implement and see the difference happen. So you've just seen an amazing video about the challenges and opportunities before us with respect to behavioral health, access, and delivery. Let me focus on a couple of statistics that were featured in the film. In the US, roughly 1 in 4 persons is having issues with behavioral health. And in Massachusetts, the number is closer to 30%, not 25%. For young adults, it was 50%. Given the average size of families in the United States, that means that every single family has 1 or 2 people suffering with behavioral health issues. And while the direct cost of behavioral health is huge, now approaching $300 billion per year in the US treating behavioral health conditions, the indirect costs are even more startling and worrisome, from absenteeism at work and at school to physical, medical expenditures that are 2 to 4 times higher for those who have behavioral health conditions versus those who do not. But back to access. While primary care is the first place individuals seek help, according to the Primary Care Collaborative, 2/3 of primary care physicians who see a patient and understand that they have behavioral health needs cannot find a way to get them the care that they need to access that care. 2/3 of the time. As you saw in the film here in Merrimack Valley, only 2 to 3% of our patients are actually getting the behavioral health care that they need. The great irony is that community health centers were founded in the 1960s to address the holistic needs of people. And it was in 1978 that the World Health Organization at its conference in Alta, Kazakhstan, a few of those in the world, identified primary health care, and particularly the integration of behavioral health and addressing the other social drivers of health as being the fundamental key to better health for all. So here in the Merrimack Valley, the Columbia gas explosion, the COVID pandemic only made the matter worse. 64% of people who actually went in and had a behavioral health session said that the Columbia gas explosion and the pandemic drove them to having worsening behavioral health problems. The point is, we've got a lot of work to do to re-engineer Greater Lawrence Family Health Center, to fulfill this intended mission by addressing behavioral health and having that as an integrated part of the care that we deliver. Here at GLFHC, my senior management team and I are actively making plans to improve the lives of the citizens of the Merrimack Valley. We are working on establishing a site for acute care with our partners at Lawrence Community Works. We're developing ideas for a women's center with Esperanza Academy. We're seeking to expand our, thank you, Esperanza. We are seeking to expand our social services and street medicine program as well. But to the point of this evening, we are looking to massively expand our behavioral health services and offerings to deliver on the promise of holistic care in Lawrence for Laurentians. This is not the first time that GLFHC has thought about behavioral health or even tried it. But it's far more likely to succeed right now because the Commonwealth of Massachusetts under the Baker administration and Mary Lou Sutters have really redesigned their payments, their policies, and their programs to support behavioral health delivery. There are so many aspects of the new proposal for how to do this that is simply breathtaking. And while Governor Baker will be on stage with me in a moment to speak as our keynote, I'm sure touching upon COVID and behavioral health, I would like to press upon you one more time to reflect on the lives changed, transformed, and sometimes, frankly, just saved by the provisioning of mental health services here at GLFHC. Please consider that as we proceed through the evening fundraiser. There's so much more we can do with your help and support, so thank you. And now I have the honor of introducing someone who actually needs no introduction. He's a very special guest at this Make a Difference Gala, Governor Charlie Baker. We're proud to have him return after 4 years. There were, I think, a few entering residents who were here and have returned now 4 years later. Dr. Kara and Dr. Rebecca, you want to wave or stand? Where are they? There they are. Okay. They are fourth-year residents in our residency program, and Governor Baker swore he would come back to see them off. So here he is. Since taking office in 2015, Governor Baker and Lieutenant Governor Karen Polito have assembled a diverse team that's put forth a get stuff done approach to building state government. It's thrifty, it's hardworking, creative as the people of Massachusetts. Your administration, Governor Baker, has bolstered aid for schools and communities. You've invested in reliable public transportation and prioritized funding to fight the opioid and heroin epidemic in the state. These efforts all complement the work that we do at Greater Lawrence Family Health Center to improve the lives of patients and community. And in the last 2 years, for sure, the leadership has really worked alongside the health institutions like GLFHC, combating and addressing the pandemic and understanding the value of community health centers to all residents of the Commonwealth, especially the underserved and those most in need. So with that as background for all the amazing work he's done and the friend that he's been to the health center, I'd like to bring to the podium for our keynote address, Governor Baker.
So this thing makes me a little nervous. Can those students come up here for a sec? I'm not kidding. I want the students to come up here. Be all right. So first of all, there's a whole bunch of servers across the back of the room. Can we give those folks a round of applause? It's really nice to see you in person in this room. I didn't realize it's been 4 years since I've been here. I thought it'd been 3 years. Was I not here in 19? Was it 18? That makes me feel bad because that means I came during the election year. I was supposed to come after the election year. So, very funny. I got that. I'm going to be really brief because tonight is really about Greater Lawrence Family Health Center and John Isaacson. And I do want to say just a couple things. The first is the past 2 years have been like no other, and everybody in this room knows that. And we did a lot of important work with many of the folks in this room on behalf of the people in Merrimack Valley to work through the pandemic. And I just want to say, if there's one thing I took away from all this, it's the extraordinary level of kindness and grace and generosity that people showed to their friends and their neighbors and their colleagues and their communities throughout this thing. There was a call every Tuesday night starting in around March of 2020, and it lasted pretty much through 2020 and into 2021, where a bunch of governors would get on the phone at 8 o'clock Eastern Standard Time, 5 o'clock in California, and just talk. I mean, you never knew how many governors were actually on the call. There was no set agenda. It was like a therapy session for us, and to help us deal with our mental health issues. And I would, and I get off these calls. Sometimes they lasted an hour. Sometimes they literally lasted for 2 or 3 hours. And I'm sure people came on and off during the course of the call. And I would get off them and I would go find my wife and I would say, I'm getting a sense about how this whole thing is going, this COVID thing in other states and other parts of the country. And I have to say how grateful I am that I'm working this issue in Massachusetts because because when I would ask for help with food insecurity, every hand went up. When I would say I need help setting up testing sites, hands went up. When I said we need help with vaccines, hands went up. I mean, there was no thing that we reached out to people for where people didn't say, I can help. And there was a lot of serious tension going on associated with this thing all over the country. And the stuff people would talk about on these calls, I really came away from every one of them saying, this is an enormous challenge and it's incredibly difficult and it makes everybody sort of suffer in one way or another. But honestly, I don't think sometimes when you're in the middle of something like that, you appreciate contextually how you're handling it relative to the way a lot of other people are. And just time and time again, I would get off these calls and say, people here really rose to the occasion and tried to find the kindness in what was an enormously challenging and high anxiety period. And I just saw it every single day. And I don't want any of you, and I say this, my guys in the back will vouch for me on this. I say this in practically every public event I do these days. I don't want you to not appreciate just how very special the people of the Commonwealth were to each other over the course of the past couple of years, because it did not happen everywhere. Okay. It did not happen everywhere. And I want you to know that. And the second thing I just want to say is, we have, lost a bunch of time that we expected to be spending on other stuff over the previous 2 years. I filed a mental health bill to increase spending on mental health by about $1 billion in Massachusetts in 2019. And it just kind of got lost when everything went nuts in March of 2020. This was a challenge and an issue before the pandemic. And all the pandemic really did was make it more so. And we filed a fairly similar bill again a few weeks ago. And I think we have the legislature's attention on this time because of what happened. Because of what happened during the course of the pandemic, people are finally like, yeah, we need to do more with this. This is a much bigger problem than we realized. And just to give you some idea, if this legislation we file gets passed, we will be investing an additional $1.4 billion in primary care, behavioral health, and addiction services in Massachusetts over the next 5 years. And we need to. And this is a little bit of weed whacking, and I apologize for that. But part of the reason why this feels like an area where we are so short with respect to where we should be from a staffing and a services and everything else point of view is because honestly, under national federal policy, primary care and behavioral health were just never the place where we made the big investments, right? If you look at the Medicare fee schedule, if you look at the way we measure intensity, it's all about technology. And so we have built an incredibly muscular healthcare system. We have more technology than anybody else in the world and more access to it. And that's not a bad thing. It's a good thing. It saves a lot of lives. But what we didn't do over the past 40 years while we were doing that was invest in time. Time is, for mental health services, primary care, geriatric, addiction services, time is a huge part of how you actually treat people. And it doesn't get the respect in the payment system nationally that the entire way we pay for healthcare is built on. And that also translates into where a lot of the research goes. And I can't do anything about the research piece, but if we can get legislation passed to sort of flip the parameter a bit here and say, we really need to invest in time. And when you're talking time, you're talking primary care, geriatrics, behavioral health, and addiction services. We will send a message to the provider community and to others that we are going to be putting more resources into this space, and therefore more people may choose to go there. I think what you folks are up to is special. Thank you, Doctor, for talking about the investments that we're making as a state on the Commonwealth side into this area. It's really big money and it's necessary because we did have a crisis in behavioral health before the pandemic, and now it's significantly more so. And I can certainly tell you that between now and the end of my term, we're going to continue to push the needle on this one, push the envelope, not the needle. Oops, because I mixed my metaphors up a bit there. Because this is an area where we have a lot of work to do and a lot of catching up to do. And it's a big part of how we help people. The pandemic comes with aftershocks, okay? We're going to be dealing with all kinds of things that represent sort of the echo that comes out of this thing. And there's no question, one of the echoes we're all going to need to work through is the behavioral health one. The learning loss one is absolutely there. We're going to have to work on that one. Some of the issues around addiction, we're going to have to work on that one. There's a whole bunch of things that even as the vaccines have been distributed and even as therapies have been developed, all that other stuff has been done. There's going to be a whole bunch of things. My housing agenda just flatlined for all intents and purposes. And, we got to get back and start cranking the crank again on housing production because, housing is a problem housing was a problem in Massachusetts before the pandemic, right? Now it's more so. And there's a whole bunch of those things which we're just going to have to incorporate into the way we think about how we come out of this. But I'll tell you one thing I know for sure, because again, I've had 7.5 years to watch it. There's one thing that people in Massachusetts are good at, it's pivoting and focusing and facing the big challenge and then finding a way to come together and get it done. And I've seen that over and over again. And the doctor mentioned the Merrimack Valley gas explosions. I'll tell you something. I saw it firsthand on that one too. The people in the Merrimack Valley were there for each other every single day during that whole rebuild as we went through the aftermath of that terrible day. And I just want to say how grateful I am. How grateful I am to all of you and to your neighbors and to your friends and to the communities you're part of for giving me a chance to be part of yours for the past 7 years. Because I'll tell you something, it's a beautiful place. I love coming here, and I will certainly be back whether I'm in this job or doing something else. And I just want to thank you for that. So thank you.
Thank you, Governor Baker. We are so thrilled that you were able to come back again this year. We do have a small token of appreciation for you, so if you don't mind coming up just for a second. So we know that we found out from Governor Baker's office that he loves books, history books. So we got him this signed book by the author of Explorers. And then we, of course, gave him his own KN95 mask and a rapid test as well, just in case he needs that. Thank you.
I have a whole house full of these.
It's now my pleasure to introduce you to the 2022 recipient of Greater Lawrence Family Health Center's Making a Difference Award. Tonight's recipient is a graduate of the University of Michigan and the chairman and CEO of the GEM Group Incorporated, a privately held, multiple award-winning supplier of high-quality business gifts to the promotional and branded merchandise markets. GEM has been recognized as one of the 12 largest companies in the industry, and in 2021 was named Supplier of the Year by Counselor Magazine. With its primary operation in Lawrence, Massachusetts, they are one of the largest employers in the region. And they also have a technical facility in Shenzhen, China. Starting in the spring of 2020, as a result of the pandemic, the company leveraged its deep international supply chain, quality, and logistics capabilities to deliver tens of millions of units of high-quality, critical PPE to senior living operators, corporations, and healthcare facilities like GLFHC. In 2022, GEMline was the recipient of the Next Century Award for contributions to the economic well-being of Massachusetts from the Associated Industries of Massachusetts. He is a founding board member and currently serves on the executive committee of the Lawrence Partnership, a public-private economic development agency where he chaired the COVID task force. And he did one heck of a job chairing that task force. And there was a lot of people in this room that were on that task force. He is a leader and a philanthropist and one heck of a guy that has made a huge difference for so many in our community. Please join us in welcoming and congratulating Jonathan Isaacson.
I'm all that stands between you and dinner. So if you sit down, we can get you fed, and A little less of the reverb. Governor Baker, Senator Feingold, Representative Devers, Mayor DePena, Councilors DePlante, Infante, Reyes, Payano, Dr. Fish, and distinguished guests. Many of you may have been surprised when it was announced that I was being honored by the Greater Lawrence Family Health Center, but I can promise that nobody was more surprised than I was. When Dr. Fish and Rich Napolitano called, I was quite speechless, which many of you know is not a state that occurs often with me. On a side note, I have to say how grateful I am to the people who made an invitation for this event that made me look taller than the governor. And in a few minutes, you're going to see how funny this actually is. I will also say that it's a bit ironic that Governor Baker is the keynote tonight. Governor, I would be very surprised if you remembered this, but the very week you were elected, you were also the keynote speaker when I was presented by the Beacon Award by Compass for Kids. What I remember most from that day was not your speech, but what happened when somebody else was speaking. A woman was talking about her journey with Compass, and at one point she became too emotional to continue, and the room sat in uncomfortable silence. You began to clap, drawing everybody else in, which gave her the time, space, and support to move on. The way you lent a dignified helping hand gave me a deep respect for your humanity and caring. So with this, it's very appropriate that you and everyone else here is here to celebrate the Greater Lawrence Family Health Center and the people that it so ably serves. I have the great joy and privilege of being able to work with hundreds of people who call Lawrence home. The media likes to highlight a gateway city with a lot of challenges, but that's not the real story. What I see is a warm and welcoming spirit, a focus on family and friends, an incredible work ethic, and people working together for the good of the community. And a lot of reverb. When we moved Gemline here in 1996, we found not only the spirit, but talent eager to learn and to grow. We hired from the local community. Our company grew and thrived in Lawrence. At Gemline, we believe in engaging with the community. This is because we understand that for a community to work well, business needs to play a productive part. This is beyond our role as employer and taxpayer, which are indeed important. From a selfish standpoint, if we want to have a productive and engaged workforce, we need to invest in the communities in which they live. From the standpoint of a citizen of a country that seems to be having an identity crisis, or perhaps a midlife crisis, if we do not invest in the success and health of our citizens, we simply will not remain the kind of country that the world needs us to be. It was with this backdrop that in 2014, I received a call from Senator Barry Feingold. He asked me to join a meeting of a new organization being formed called the Lawrence Partnership. With exceptional leadership from NECC President Lane Glenn, the Lawrence Partnership was formed. It has done and continues to do important and meaningful work. And in fact, the Greater Lawrence Family Health Center has recognized their impact. In 2020, the Lawrence Partnership was honored by the Health Center with their Making a Difference Award. As it did with so many others, COVID stole the chance to celebrate the partnership's success when the gala was canceled. This is actually the first time we're back together again in person. The good news is that with us tonight, we have current partnership chair Wendy Estrella, director George Ramirez, former director Derek Mitchell, and former chairs Marianne Paley-Nadell and Lane Glenn. It is a bit late, but I hope you will join me in taking a minute to recognize them and the partnership for their work and for their award. It was at the partnership board meetings that I learned about the health center and met the former CEO, John Silva and Rich Napolitano. A few years back, Rich and John asked me to join into a feasibility study for a capital campaign at the health center. In the history of capital campaigns, going back to campaigns run by the Roman Empire, I don't think there was ever a feasibility study that decided not to move forward with the formal campaign. At least I've not seen one, and I've seen a fair amount in this town. So as a part of the study, I was invited to a health center facility, and after being interviewed to figure out how much they should ask us for, my guide, Steve Crowell, took me for a tour of the center. John and Rich did not know it, but after that tour, I had already decided we would make a leadership contribution. The sheer number of patients that day was truly astonishing. More impressive was the staff I met during the tour. An incredible, dedicated team committed to health equity and serving the community. Steve himself had spent the prior 2 years working with the homeless in Lawrence. In spite of what must have been an incredibly challenging job, he smiled the entire time as he took me around to introduce me to the team. And it was at that point that I really understood the impact of a place like the Greater Lawrence Family Health Center on the community. When the pandemic hit in March of 2022, the community was still processing the trauma of the September 2018 gas explosions. While many of us went home, our healthcare professionals did not have that option. The health center, Lawrence General, and Holy Family, among others, were on the front line. It was at that time that I received an email from Eileen Reynolds at Beth Israel Hospital in Boston titled Hail Mary. They were struggling with COVID, had run short of PPE, and needed help. Assisted by a team of scientists from the University of Michigan, we pivoted. 2 weeks after the governor asked that we close, we reopened. Over the next 24 months, Team Gemline quietly moved over 350 air shipments and more than 50 containers of high-quality PPE through a supply chain system that had come apart at the seams. It was a difficult time, but I will say with pride that out of the almost 70 million units of PPE we delivered, 0 came back because we did not meet a standard. And as the health center will tell you, as well as a number of other hospitals, shelters, pantries, and community institutions, we did not charge them, but donated merchandise to those in need. We did, however, charge our corporate customers, so don't feel too badly for us. During this time, I was also asked to lead the COVID-19 task force for the Lawrence Partnership. We started by trying to stop the spread, which the entire world has found impossible, and so did we. So we pivoted. When the vaccine became available in a community effort that included leadership from Zandra Kelly at the health center, the city health officials, the hospitals led by Eduardo Haddad and Bill Goodman, among others, Socrates de la Cruz, Matthew Bonavita from New Balance, Alex Nova, and Karina Calderon, as well as Alberto and the whole El Niño, that came out badly, El Mundo team, sorry, Alberto, we turned to getting people vaccinated. We made a difference for the community. We came up with safe, effective, and free before any government. In one meeting, as we were working on ways to convince people to get vaccinated, I noted that there was too much friction between people and the vaccine. While some could navigate the system, for others, it was simply too much of a maze. We needed to bring the vaccine to people rather than bringing people to the vaccine. At this point, the vaccine was mostly being done in mass vaccination sites or with small remote setups. So once again, as so many do, we turned to the health center. Led by Diane Martin and her dedicated team, we ran 4 vaccination clinics on site at Gemline. Others, such as New Balance, did the same. With patients and caring, they provided education for our associates. This was a team effort, and the result was that in our building, out of a staff of about 500, at last check, we have about a dozen to get over the vaccination threshold. I suspect that nobody in the room is surprised to hear me talk about the impact of the health center, especially during a crisis. The team at the health center and many others went above and beyond the call during the pandemic. Our healthcare professionals, first responders, teachers, community leaders, and frontline folks showed up every day, including at Gemline, in the face of a difficult and frightening virus. The reality is that there are many people that deserve recognition for their efforts during this time, and we should not leave tonight without acknowledging the substantial impact made by these people. We remain in their debt. As we hopefully move into the next phases of the pandemic, the team at Greater Lawrence Family Health Center continues to provide critical caring services to those in need. And all of this in the face of a crisis with our healthcare professionals. The people engaged in providing healthcare, in taking care of us, have been pushed to the point of breaking. They deserve better, and as Guy Fish said, we can't just tell them to do more yoga. And as I worried about back in the spring of 2020, when I was almost literally jumping up and down at partnership meetings, the virus has taken a toll on our community. There was and is real suffering. The mental health crisis is real. The event tonight will help to fund behavioral health initiatives. It's clear the enormous toll that COVID has taken on the mental health of our community. Investing in the mental health of the community is critical to a vibrant and equitable society. So with this, I have a challenge. Additional to what we have donated, Gemline will commit another $250,000 in a matching grant for any new gift made. So for any new gift made tonight, we will match it 2 for 1, meaning for any dollar committed, we'll match $2. And after tonight until July 4th, we will match any donation 1 for 1. Please spend our money. The Greater Lawrence Family Health Center and the people in this community deserve our investment, and they need the resources to deal with the crisis at hand. I hope our gift tonight and our story in Lawrence gets other individuals and companies, especially mid-market companies, to engage. I hope many of you are moved to join us. And while I am certainly grateful to Dr. Fish and the Greater Lawrence Family Health Center for the recognition tonight, I am more grateful for their commitment to the community and the work their dedicated team does every day. Thank you.
So if I could, I just want to read the inscription on this. This is a picture that we give every year to our Making a Difference recipient. It's done by a photographer that's actually here in this room, Bob Lucier. So thank you, Bob. And to Jonathan Isaacson, in recognition of your tireless efforts to help those in need during the COVID-19 pandemic, we thank you.
This is good if you have a shout out. Thank you, thank you.
I remember that moment. I do. Yeah, really appreciate it. Really appreciate it. And I was almost going to put a picture of Danny. And of course, he's married to one. I don't listen to it. That's what happened. Anyway, thank you. But she thinks you listen. No, she doesn't. Thank you so much. Thank you. I hope that was live.
Thank you.
All right, thank you. Appreciate it. All right, all right.
Wow, what a special announcement that Jonathan just made for behavioral health at Greater Lawrence Family Health Center. If this is not someone who's truly made a difference in our community, I don't know what is. Jonathan, just tremendous, and thank you for your remarks. Before we go to dinner, I just wanted to show you all at your table, there's a program card on every seat. On the back of that program card, I didn't mention it earlier, we have a fund a need program that we do at our events. And in light of Jonathan's announcement just now, I hope that you all will consider making a gift to the Fund a Need tonight, as it will be matched 2 to 1 from Jonathan's Outstanding Challenge Grant. So thank you for your consideration, and please enjoy dinner. Before I start up the program again, some people have asked us about these the fund to need cards. If you do have one, if you see one of the members of our committee, they have the purple Hawaiian lays on their necks, and there's other people walking around. You can just give it to them if you'd like to. That would be great. We know quite a few of you have already committed and made a contribution, which we really appreciate. If I could get your attention. I'd like to continue our program, and I'd like to now introduce to you one of GLFHC's newest friends and benefactors. He was introduced to me through the customer service that he received at one of our vaccine clinics. I'm going to let him tell the story after I finish introducing him, but suffice it to say, our world could use a lot more people like this gentleman and his family. Bernard R. Horn is a graduate of Northeastern University, and he's the president and portfolio manager of Polaris Capital Management, LLC, a leading Boston-based global and international value equity firm. Mr. Horn founded Polaris in April of 1995 to expand his existing client base dating to the early 1980s. Mr. Horn's pure global value philosophy combines investment technology with traditional fundamental research. His 30-plus year track record exceeds most current competitors in length and has produced admirable risk-adjusted returns since inception. He's known as a forerunner in global and international investing. Mr. Horn has been profiled in the Wall Street Journal, Bloomberg Businessweek, Financial Times, Forbes, Fortune, the New York Times, Smart Money, Investors Business Daily, the Washington Post, and many other national publications. He's appeared on PBS Nightly Business Report, PBS Consuelo Mac, Wealth Track, CNBC, CNN, and Bloomberg TV to discuss global market trends. In addition, Mr. Horn has served as a guest lecturer at various investor events, including the American Association of Individual Investors Conference, Value Investing Congress, Bloomberg Portfolio Manager, Mashup. In addition to his responsibilities at Polaris, Mr. Horn is actively involved in many volunteer activities and charitable organizations, including now GLFHC. But this also includes the Reading Library, where he lives, his hometown. He serves on various MIT boards, including the advisory board of the Legatum Center for Development and Entrepreneurship, the Sloan Finance Group Advisory Board, and the Center for Finance and Policy Advisory Board. I would really like to welcome Bernie Horn to the stage now. He's going to help us with some special recognition before we close the program tonight.
Thanks, Rich. My remarks are going to be a little bit more on the detailed side. Just with respect to details, we had a little bit of feedback here, so I try to figure this out. So it looks like we have a live mic here because we're live streaming this event. So you may be recorded. But yeah, so I like to, this is a bit off script here, but a lot of my remarks will be about the details that this organization has, and the ladies in the audience can relate to this because, when it comes to things like eyebrows and nails, and now the latest thing is the eyelashes, it's all about the details, right, ladies? So thank you Thank you, Rich. So Rich asked me to share a little bit of the background on how my wife Lorraine and I decided to help GLFC. So Lorraine is a registered nurse. I'm an investment advisor, as Rich noted. I've got about 40 plus years experience traveling around the world to identify the best investments for our clients' portfolios. And I'd like to make an observation first before I get started that comes from these experiences of looking for great organizations around the world. And that is that organizational excellence is achieved by few firms, but can be measured in many ways and is present at all levels in an organization. So we learned about GLFHC through the family grapevine, actually, when my niece, Danielle, who's actually here tonight, left a very promising career at CVS to join this health center in Lawrence. And I thought it was a bit curious because I knew that CVS was embarking on a new strategy to use their retail pharmacies to transform how healthcare is being delivered in the country. But knowing that Danielle was extraordinarily bright, I knew that something must be going on here for her to make that change. And so I just sort of mentally filed that data point away. Then fast forward, we found ourselves in the dark days of COVID. Vaccines had been approved, but there was very high anxiety, if you remember, among everybody as to where in the world would I get a vaccine? Could I get a vaccine? When could I be eligible to be vaccinated? The distribution was controlled. I couldn't go to my primary care physician to get a vaccine like I would normally get a flu vaccine. And then one day, there's a little email that came through the family email chain from Danielle saying that she was at a clinic giving out vaccines, and they needed to use these because, as you know, the temperature issues was really a fundamental factor. So I happened to be in the age group for getting that, and I showed up at 700 Essex Street, and this was like a converted storefront. I mean, really? It was just struck me that this organization was doing everything it possibly could to break down walls and doors to get the vaccinations out to people. It was just that struck me as being an incredible detail on how excellent the organization might be. But so I showed up. The staff was on point. Everything went smoothly, and I kind of went away and waited a month. So a month goes by, and I'm ready for my second shot. And when I learned about that, I called in to see what my appointment was, and I had somehow been dropped from the system. And so I said, well, that's interesting. So I called up and tried to resolve the issue, but then the call I was on got dropped. So, I'm a CEO of a company, can-do attitude. So I go into my, problem resolution mode, if you will, right? And before I could do anything, the receptionist at our company called in and said, I had a call waiting from Greater Lawrence Family Health Center. I'm like, that's weird. How do they know me? But the young lady on the phone confidently told me that she would figure out the issue, would be sure to get an appointment. And sure enough, that very day, I was on my way up to 700 Essex to get my second shot. But I was struck by her confidence, persistence to track me down. I was greatly relieved that, she fixed the problem and I was on my way. But as I listened to her can-do manner on the phone, it just struck me that she had to be working for some place that, first of all, I called from my office switchboard. Somehow, after the call got dropped, she was smart enough and well-trained enough to find the telephone number from my switchboard on her switchboard, called me up. She hunted me down because she knew there was a patient out there that somehow needed to be cared for. And I knew that this level of service only happens in a kind of high performance organization. And that starts at the top, and it exists at every level in the organization, right down to, or right at the front level, that front level facing people in the organization. So, that's kind of, reminds me in some ways of, in her book, The Good Job Strategy, Professor Zeynep Tan at MIT describes how this sort of training takes place in high-performing organizations, where every level of the organization is empowered to make things happen and get things done. So anyway, that's kind of an introduction as to how I got involved. The rest of the story is getting to know Rich and his team, the entire organization, being introduced to the tremendous efforts and program at the residency here. Certainly an incredibly well-known and nationally recognized residency program. But there are a lot of other small details. Greater Lawrence Family Healthcare was one of the first health centers to be selected as a vaccination distribution site for the federal government. They administered over 140,000 vaccines to over 60,000 patients at 3 primary sites and over 100 pop-up sites, as Jonathan sort of described earlier. Tremendous. Accounting for over 10% of the vaccines distributed by all community healthcare organizations in the state. Over 100,000 COVID PCR tests. On the coldest and hottest days of the year, no matter what the weather, people were here. You don't work from home when you're in this organization. You must be out there on the front line. So distributed over 20,000 rapid tests. In the 70s, my wife, knowing healthcare at the time, we joined something called the Harvard Community Health Plan, which was one of the very first HMOs, and really set the stage for what was, to develop in the healthcare system in this country. And I know, Governor Baker was here before, but he was actually CEO of the Harvard Community Health Plan many years ago before he got into politics. And, we were, really truly blessed to have somebody who is a healthcare professional leading this state through the worst pandemic that this country has ever witnessed. So I think, in many ways, what Greater Lawrence Family Healthcare Center is doing now is very much that same tradition where many organizations have grown, become very bureaucratic, but the organization is flat. It's incredibly well managed. And, so look, I think I've talked enough here, but, I just want to say that the spirit and the soul of this organization is infectious in a very good way. And, it really is catchy. It's great to be involved. We invest in a lot of things or a lot of organizations, that people can contribute to. But I have to say that Lorraine and I are extraordinarily thankful for the opportunity to invest in, this kind of social entrepreneurship and doing everything that you do here. So thanks for all the great work that you all do here. And we're just very, very proud to be part of it. So thanks again.
So that brings us to the special recognition that we really haven't given too much detail on tonight. But when we talk about COVID and we talk about vaccines and testing and the numbers that Mr. Horn just mentioned, if Mr. Horn and Guy, if you could come back up, just to maybe to help me out here, that would be great. So what I'd like to, if you could take that from me. So for the first time ever in the Making a Difference Gala history, we're going to recognize tonight two very, very important people, two special people that I get to work with every day. We get to work with at the health center every day. And if it wasn't for these two people leading hundreds of people that have participated in making sure that we gave those 100,000 tests and we distributed those 140,000 vaccines, I don't know what we would have done. So it's my pleasure tonight to recognize my two colleagues, Sandra Silva and Diane Martin. Sandra, Diane Martin is our Senior Vice President for Pharmacy Services. She's been with the health center, I found out today to make sure, 17 years. I don't know how long Sandra has been here, but I will tell you she's been here since she was 16 years old. She's been with the health center since she was in high school, and she's never left. And we're all too grateful for that. Well, I don't know what we would do without these two folks, but they led a lot of people in this room that worked in the vaccines and the testing, and we certainly couldn't do it without their leadership. So thank you, Sandra and Diane. So this has been one great night. And I do want to make one more plug because I wouldn't be doing my job if I didn't. Yes. But before I do that, I do want to mention that, and I want to welcome Lawrence's newest mayor, Mayor Brian DePena. Thank you for being here. Thank you so much for being here. It really means a lot. Thank you, Mayor. And I will make one last mention of the Fund in Need and what I'm calling with my team, whether he likes it or not, the Isaacson Challenge, or we can call it the GEM Challenge, whatever he chooses. But I do want to remind you all of that. And, I can't thank you enough. Tonight's Making a Difference Gala, I will tell you, has raised more money than it's ever raised before. And it's thanks to all of you. Thank you so much. Anybody that bid on silent auction items tonight, those can be found at the signs in the checkout in the back. The committee, I do want to recognize the committee that's led by Mary Lyman, our Director of Community Relations and Special Events. She's been doing this for 10 or 11 years, and it gets better every year. So thank you, Mary. I also want to thank the development team led by David Hall, our Associate Vice President. And of course, thank you so much to Terry Moran. Terry Moran helps us every year with the media, and thank you so much. We're gonna work on the mics and the feedback for next year, but I think we pulled it off. So, and I also want to make a special mention of Steve Genovese's and Flowers by Steve, who helped us with the centerpieces this evening. So, and you want me to do? I also wanted to if I could recognize before we leave tonight, I want to make a special recognition over here on these 3 or 4 tables is our wonderful board of directors from Greater Lawrence Family Health Center. If you could all stand. And I know we have one board member out there, Francis. So, But thank you so much for all you do. You all help us make a difference every day. And without you, we couldn't do what we're doing. And we look forward to expanding behavioral health services for this community. Thank you so much.